There are instances where you start with preventive care and it leads to diagnostic care and sometimes in the same visit.
Welcome to Under the Coverage,
During each episode, we interview people, sometimes it's just each other.
who spend their working days focused on health benefits and healthcare.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits system.
I'm Jolene Myers.
And I'm Sarah Flusky, and we're ready to lament,
Complain,
empathize, and maybe help a few people.
Today, we're digging into one of the most confusing parts of your health benefits: why your free checkup might not be free. So first, we want to talk about preventive care. The ACA currently requires that most health plans cover certain services at no cost. So this includes immunizations, screenings like well visits with your PCP, and for conditions like colorectal cancer and diabetes and even depression. There are also some preventive medications that are covered for certain individuals, like aspirin and folic acid supplements.
Yeah, so the USPSTF has an A and B listing. This is tied to the Affordable Care Act, or the ACA, and it outlines really narrowly what things have to be covered by a benefit plan in the United States at zero cost. And they're very narrow descriptions. So a portion of what they outline is free. So if I go to a well visit with my primary care doctor, that is a free visit. If that visit becomes a diagnostic visit, so if I go in for my well visit and I say I've been having, heart palpitations, and they decide to run an EKG in the office, my well visit will be accompanied by a charge for diagnostic care. So there are instances where you start with preventive care and it leads to diagnostic care and sometimes in the same visit, which is what can make this confusing.
Mm.
So a mammogram is a preventive visit. But if they find something that requires more imaging, you might have more imaging that same day, and that diagnostic imaging now to diagnose might incur a charge where the screening itself is zero. But if you need further diagnostic analysis, that stuff ends up costing money. So on its surface, there are a lot of things that have to be covered at zero cost, but they can easily turn into diagnostic. So diagnostic is any visitor service that is designed to identify or diagnose a disease, a condition, an illness, an injury, where they're performing anything other than a basic physical. Basic physical, $0.
But anything additional, diagnostic care, you can expect a bill,
Yeah.
or at the very least, a copay.
At the very least, a copay, 100%. Yeah. It's a fine line. There are some things that you'll see on your plan that are covered at $0. And if it falls under this A and B listing, so the Affordable Care Act requires that we have access to certain preventive services
As
of zero cost as of September 2025 when we're recording this.
Because these
So
things can change on a dime.
absolutely could change in terms of what is included in the Affordable Care Act and how that impacts plans nationally across the United States. But with that list at the moment, immunizations are covered, folic acid supplements for pregnant women are covered at zero copay. Those items can change as that listing changes in terms of what is required to be covered. And it's possible that a free visit can turn into a visit with a bill or a copay because you are now getting diagnostic care on top of a well visit. So you might have to pay for a free visit.
Yeah. So now you know the difference between preventive and diagnostic care. At least we hope so. And you can walk into your next doctor's appointment prepared.
Yeah. So our next episode, we're going to unpack what mental health benefits really cover.
Should be a good one.
Thanks, Joe.
Thank you. This podcast is brought to you by Nova Healthcare Administrators.
Have a question or a situation you'd like advice about?
You can find us on X at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like or subscribe, but most importantly, share. We'll find the insiders.
You share it with the outsiders.